The first 24 hours after an act of domestic abuse happens are critical for survivors, their ability to get help and get out of that situation.
That frontline response often falls on a team of doctors, hospital workers, and community activists when law enforcement and the courts can't get them help fast enough. Marissa Perlman has the story of those who answer the call.
Bruises and broken bones, stabbings and shootings. A growing number of domestic violence victims end up in the hospital, some repeatedly.
We have seen patients who've come here with one injury, and then the next time they come, they don't make it.
Dr. Ann Stay, a trauma surgeon at Northwestern Memorial Hospital, too often has to heal the physical wounds of domestic violence.
Violence often becomes a language that people start being exposed to in the home, sometimes from a very young age.
She's part of the hospital's first response to DV cases. Outside of the ER, she does research on ways to break the cycle for her patients. Studies show survivors of intimate partner violence are more than twice as likely to return to the ER within 30 days. That's why Dr. Stay says the follow-up matters just as much as the first response. And she says poverty and unemployment are among the strongest predictors of domestic violence. According to the Bureau of Justice Statistics, women in households earning under $25,000 face abuse at 3 times the rate of those with higher incomes. Unemployment increases the risk of domestic violence by more than 30%.
We think about what happens after they get discharged, what happens once they get home, even if they even get home.
Daisy Vega works alongside Dr. Stay as the hospital's violence intervention coordinator, helping survivors access resources, a safe place to stay, or victim compensation funding up to a year after their hospital stay, a critical time to help them escape any ongoing danger.
Some people I was meant to get shot at some point, and that's just the life that they think they are going to have.
I've been in the room when they were told. I hear the screams.
Gwen Baxter has herself lived with domestic violence in a time when she said resources were scarce. She now works with Aclivis, a program that partners with 6 hospitals to help survivors, from housing to food and legal aid. These hospital-based programs can reduce the risk of re-injury by up to 60%, according to the American College of Surgeons.
And if they just know they got that type of support system, they become strong. They see outside of that relationship, because some of them feel like they in too deep.
This team working to not just heal wounds, but to give hope.
And those responders and case managers are often on site at the hospital to de-escalate the situation, provide advocacy, and act as a resource to prevent further violence. We now know more than 12,000 victims of violence have turned to Aclivis for help during that what's next time period.
That's a lot,
Erica?
and an indication of just how serious this is.
Exactly.
But I'm sure that support net means the world to them, to have that available when they're not sure which way to turn or go.
Exactly. Just navigating what's next.
Yeah.
Yeah.
Thanks.
Thank you.